Maggie,
Hey,
can you pause the recording? Thanks, Maggie. We'll wait a couple more minutes. The dogs have stopped barking. Why is there always a delivery as soon as you have to go on the mic? Okay, hello everyone. As I said a couple minutes ago, Kathy is away. So Maggie and I were asked to pinch hit here and we'll do our very best. Anybody that's online who has a name that's not represented on their Zoom, can you please put in the chat who's with you in the room for CME credits? We need a list of your names. And I am very pleased to introduce Taylor Matson, who is a community health promoter at the North Bay Parry Sound District Health Unit. At the health unit, Taylor works in the healthy aging and fall prevention portfolio, and that includes the Stay on Your Feet strategy, which is a partnership with four public health units in Northeastern Ontario and Ontario Health Northeast. Taylor is also currently the chair of the Parry Sound District Age Friendly Community Committee, and she's here to speak to us about the needs assessment that was completed last fall. So welcome, Taylor. And if you have any questions, if you could put them in the chat, and we will wait until the end to answer questions and look for some group discussion. Thank you.
Thanks, Lisa. Hi, everyone. As mentioned, my name's Taylor. I am a community health promoter here at the North Bay Parry Sound District Health Unit. Thank you for having me today. I am here, as Lisa mentioned, to talk about the findings from the age-friendly needs assessment that was conducted in the fall, late summer, early fall of 2024 in the Parry Sound District. And it's very relevant because it's the end of Seniors Month, so happy to talk about this topic today at the Grand Rounds. So I don't have any disclosures to make. As mentioned previously, I do work at the local health unit and have not received any financial or in-kind support for this session. So in the session today, I'll review the World Health Organization's Age-Friendly Communities Framework, review the findings from the Parry Sound District Age-Friendly Community Needs Assessment, and then discuss next steps. So what is an age-friendly community? Feel free to add your thoughts in the chat. But an age-friendly community, a little bit of a definition, is a community where policies, services, and physical spaces are designed to enable people of all ages to live in secure and accessible physical and social environments. Age-friendly communities contribute to good health and allow people to participate fully in society throughout their lifetime. So for age-friendly communities, they do consider individuals of all ages and all abilities. However, with the needs assessment that I'll be speaking to today, the survey was conducted in individuals 50 years of age and up in the Parry Sound District. So in 2007, the World Health Organization identified 8 interconnected domains that fall into the three categories where policies, programming, and initiatives could be developed to support community to become um, or support a community to become age friendly. These categories include the built environment, which includes outdoor spaces and buildings, transportation, and housing. Also, social environments, including social participation, respect and social inclusion, and civic participation and employment. And then finally, community and health services. And under this, it includes communication and information, as well as community supports and health services. So a couple years ago in the spring of 2023, a group of community partners joined to form the Parry Sound District Age Friendly Community Committee. This group really aims to make our communities across the Parry Sound District more accessible, inclusive, and livable for older adults. I have included a list on this screen of some of the organizations and community members who are currently involved in this committee, so you can see a wide range there. If you're interested in learning more about this group or would like to be involved, see the terms of reference, any information you're looking for, please don't hesitate to reach out to me. I am currently the chair and can provide you with any of that information as needed. So I've just included a few local statistics on this slide to provide that local context. So individuals 50 years of age and up make up 26,615 individuals that live in the Parry Sound District. And of the total population in that district, it accounts for 57% of that population. This is using Statistics Canada data. Adults 60 to 90 years of age comprise the highest percentage of the population in Parry Sound District. And the older adult population, 65 years and over, has increased significantly by 32.2% between 2013 and 2022 in the Parry Sound District. So there is a large percentage of older adults living in these communities. And so we want to ensure that these communities are able to service and have areas for older adults to age in place. So using the age-friendly community planning toolkit that was created from the Ontario Age-Friendly Outreach Program out of the Centre for Studies in Aging and Health at Providence Care, the group conducted a needs assessment by disseminating a survey to individuals across Parry Sound District between August and October of 2024. This research project was reviewed and approved by the Health Unit's Research Ethics Review Committee. The surveys were available to be completed online, as well as paper copies were available through many municipalities and organizations across the district. The survey included multiple choice and open-ended questions on topics related to 8 domains. This included outdoor spaces and buildings, transportation services, aging in place, long-term care, community involvement, communication, and caregiver supports. 463 respondents completed the survey during this time frame. Majority of the respondents, as you can see here in this graph, were from the West Parry Sound area, with 273 respondents identifying as from West Parry Sound, 145 from East Parry Sound, 38 from unorganized territories, and then 6 individuals from a First Nations community. Just wanted to show a bit of a reference on how we define Parry Sound and break up East and West Parry Sound, as some of the data I'll show on the next few slides will show Parry Sound broken up into East and West. So we're looking really here at the orange squares, the darker orange being that northeast part of Parry Sound, as well as the northeast and the West Parry Sound. We also included data on the northeast and central portions of the unorganized areas, and then had worked a little bit with First Nations communities, those 5 communities that are identified on this map that are in the surrounding areas of Parry Sound District. On this graph, you can see the number of respondents in each of the communities. You'll see that McKellar and Town of Parry Sound both had each 79 respondents to the survey. Whitestone had 40, Callender had 26, and then it went down from there, with Sundridge having 2 respondents. So overall, we did have a great response rate, but in individual communities, there wasn't as much representation. For the age of the respondents, 41% of respondents identified as being between the age of 61 and 70 years of age, followed by 25% being between the age of 71 and 80, and 24 being between the age of 50 and 60. Only 10% of the respondents were over the age of 81. But this is expected with the stat that I provided earlier, with majority, a high percentage of people living in Parry Sound District are in their 60s. Finally, the survey also collected data on the type of residency of the respondents. During the time of year that we did do this survey, it was when you may see a higher percentage of seasonal residents. So you can see here that majority of the respondents did identify as year-round residents of the Parry Sound District. So next I was going to go into some of the themes, but I thought I would maybe pose the question to the group, and feel free to put it in the chat if you have any thoughts on what you anticipate these themes that came across in the survey to be. Just a reminder, some of the kind of topic areas or theme or questions that we asked were about the built environment, about transportation services, aging in place services, long-term care, communication, community involvement, and caregiver supports. So just, I think some of this information won't come as a surprise, so thought you could maybe put in the chat if you have any thoughts of what those key themes might be. So maybe not as a surprise, one of the key themes that were identified when analyzing the data was that accessible transportation is needed across Parry Sound District to allow individuals to age in place. We hear about this consistently, and so it's not maybe a surprise that it was a very much a key theme. And I'll dig a little bit deeper in that and show you some of the data in the next couple of slides. The next one was that a communication plan or a directory of programs and services offered in Parry Sound District is needed. Often I hear about people needing that one place to go to find out that information, that when people really need the information, they just don't know where to go. They don't know the organization's names to connect with. And so needing that central directory came up a lot in the survey. And then finally, for this work, it's really important to continue to engage with the community members across the district to discuss planning and decision making. And so you'll see our committee is really hoping to continue to engage with the community, whether that's older adults, care partners, as well as community partners, to continue to, it doesn't just stop at this one survey. We want to continue to learn from our community of what is needed. So now I'm just going to highlight some of the data on each of these themes just to kind of share back. Respondents were asked if they felt accessible transportation services are available to take older adults to and from health appointments, including those in larger cities? That was the question that was asked. And then here is the graph just showing that data. So on the y-axis, of the graph, you'll see that percentage of respondents. And then on the x-axis, you'll see those responses of yes, no, or not being aware. So you can see here for East Parry Sound being that darker blue bar, that 52% of respondents stated that this type of transportation was available in their community versus 37% stated that it was available in West Parry Sound, being that lighter blue bar. Additionally, it does seem that West Parry Sound is maybe less aware of those services, with either people feeling that they aren't available or that they aren't aware of that accessible transportation to them. So our group is kind of hoping to share back some resources that already have been created to kind of support with sharing this information. But I'll just show next just some of the quotes that were provided through some of the open-ended questions that were asked. So these included, my daughter drives me where I need to go. I am not aware of any other services. I can't drive myself. I am not aware of transportation services to my rural residents. I rely on family to drive me to appointments. The next one is no taxis and no services for grocery store visits. Volunteer drivers are for medical reasons only. Rural area people have limited access to in-town services, unless they have family or friends to take them. And then the last one, I can't drive myself, or I can't drive and neither can my partner. So grateful West Parry Sound Community Supports provides transport services at an affordable rate. So these quotes really highlight the reliance older adults have on their family. And if an individual does not have family or friends that are close by, this is a very common barrier that we hear that this population faces, with whether it's accessing medical appointments or being able to stay active or social in their community, as well as one of the quotes mentioned about being able to even go to the grocery store. So I just wanted to share back with these findings that in 2023, a work group created an inventory of transportation services in the Parry Sound District. We have one for the Nipissing District and one for the Parry Sound District. I'm showing just a bit of a example of the first page here on this slide. The inventory highlights the services, contact information, who's eligible, service location, what types of transportation the service provides. So for example, if they only provide services for medical appointments or if they'll take you to an exercise class. It's identified on this, as well as it shows if the service has an accessible vehicle. So this is a 2-page resource for Parry Sound District and is available on the Health Unit website. I can put a link at the end of this presentation in the chat so that you can have access to this as well. Or if you are looking for paper copies to hand out to your clients or patients, or to share even within your network, please reach out to me and I can provide those paper copies to you. I'll mention that on the second page, we also included taxis or cab services, and that all of the services on these inventories or majority of them, if not all, do have a cost associated with them. So from my research, there is no such thing as free transportation. A lot of these services are offered by volunteers, and so the rate is kind of basically to cover mileage. It doesn't talk about cost on this resource, but we really encourage people that are interested in accessing these services to contact the organization to learn more, as there may be certain supports that can be put in place if financial is a barrier. Next is that key theme of communication and how we get information to older adults, or really anyone in our community. For communication, I'll show a couple of graphs of a couple of questions that we asked. So we asked respondents if information is disseminated and posted where older adults conduct their daily activities, such as post offices, places of worship, local centers, and town halls. This graph shows the response for Parry Sound as a district. So it shows the sample size of 463 respondents that answered this question, and shows that 57% of the respondents did feel that information is posted where older adults regularly attend. However, 20% stated that it wasn't, and 23% stated that they do not access these locations. And I think when they say these locations, that's referring to the locations specifically listed in the question. And maybe there are other locations that they do access, that they're just not specifically listed in this question. Next, we asked if written communication is clearly printed in large letters and easily to read with simple messaging. This graph is broken down into East and West Parry Sound respondents. 63% of respondents from West Parry Sound reported that they either do not have access to written communication or did not feel communication was clearly provided. About 50% of East Parry Sound staff or staff respondents, community residents, did say that it was available. So there is some work to do across the district, but there does seem consistently across when we look at the data that there is just a little bit of a difference in West Parry Sound. And so our group is kind of looking to kind of dig deeper into that and why is that the case. And then we also asked if information of interest to older adults is disseminated effectively. So this such information on local events, vital information, so information about health or security or financial support, and programs and services that are available to them. So you'll see here, when I combined the no and I don't know, 60% of West Parry Sound respondents said no or they weren't sure. If this information is disseminated effectively. So this could be because they're not receiving it, or they're just not sure if it's available, or it's just not top of mind for them as well. So just some really interesting data that I wanted to highlight for you. And then some of the quotes that we were provided kind of in relation to this idea of communication. So as a healthy senior, I can travel and dig for information, yet even I am constantly exacerbated by the lack of comprehensive source for learning about available social services and optional social activities or events. It's extremely fragmented. Face-to-face communication through community centers, seniors clubs, or local events help build trust and relationships. Older adults should have opportunities to ask questions and receive information directly from staff or volunteers. And then while I didn't answer no, the fact that I don't know is equally unfortunate. It is difficult to know where this information can be found when you don't even know the names of the organizations that might assist. So these quotes really highlight the confusion that individuals have when trying to navigate the health and social services in our communities. And as mentioned before, I hear all the time that because we try to provide information consistently through going to events or providing presentations. And a lot of people don't think they need the information until they really need the information. And that may be at a very stressful time. And so maybe the heightened stress at that time, plus trying to navigate the system to find a service that's available to them, can be very difficult. So really wanting to kind of dig deeper into that area and try and find some local solutions. So our committee has, so the Parry Sound District Age Friendly Community Committee has really been been trying to work with 211 to support with promoting those services that are available because they are really accessible connection services. With 211, they offer a call and a text option. You can email them, you can go online, search their directory, do a live chat. There are multiple ways to get in contact with their navigators, and there are a lot of different services listed on their site. You can also through their website, and I can put that also in the chat at the end. You can look at the dashboard and see what kind of calls are coming from the Parry Sound District or that there are no calls coming from the Parry Sound District. And so we're really looking to increase promotion of this service, as well as ensure that the service, like the local organizations, programs, and services are listed on this inventory. So if you're interested in sharing this information with your patients or clients or even with your networks, as mentioned before, just please let me know. We have received these promotional materials from 211 that we can hand out. In English and in French. And so I'm happy to share these back with organizations in the community. They're called like a tear card. So the bottom is a business card and the rest has the information about what 211 is. So they are very helpful. Additionally, a member at our committee has also created an activity calendar through 211. I will put the link in the chat also at the end of this. And it just shares local programming and events that happens throughout the Parry Sound District. You can see here that on any given day, there's anywhere from 15 to 22 different options. Mainly these are exercise classes or exercise programs, but there's also some social activities in there. So it's a great kind of overview to show if your patient is maybe outside of the Parry Sound but living in McKellar, you can see any of those different activity classes that they could attend. A lot of them are drop-ins, some of them need registration, and all of that information is when you click on them, you can find that out more. So another way that we're trying to kind of have that one place where people can go to learn more. And then that final theme of engaging. So engaging and consulting with older adults is essential to successful programming and initiatives. We asked respondents if they feel included and respected in their community. So if they felt that they are asked to participate in different initiatives, do they provide their input on community issues? And if they feel that their contributions are honored. And so here in this pie chart, 64% stated that they did feel included and respected, while 17% stated no, and 19% were unsure. So although I feel like this is a really great start, there is some work to continue to do to make sure that everyone feels included and respected. Because I feel like older adults also have a lot of valuable knowledge and information to share. And so we want to, as our work group, continue to engage to ensure that their voices are heard as well in the work that we look to do. And then this one quote, I think, really highlighted this for me. It's really exactly what I just said, but engaging with older adult community members in the planning process to understand their needs and preferences, their input can guide effective design and service delivery. So making sure older adult voices are at the table. So our committee really hopes to continue to engage older adults as we determine the next steps for this work. So we recognize that there were limitations with this research project. First was that although the response rate, as I mentioned before, did seem high with 463 respondents to the survey, there was a low response rate in individual communities, and therefore the responses may not be representative of the district as a whole and may be more representative in those communities that had a higher response rate. Next was that there was limited response from individuals who identified as being from one of the 5 First Nations communities that are close to Parry Sound. Um, as mentioned before, we had six people identified as being from First Nations communities, and I'll just in a bit kind of give more context on those lessons and how we can move forward and make sure that those voices are also heard. Additionally, the survey was shared online or through community partners' social media accounts and through organizations who volunteered to support with this dissemination. So through this, it's likely that socially isolated older adults may not have completed the survey or provided their perspectives, whether they don't have access to the internet, which many rural communities in the district don't have reliable access to, or if they're not already connected to a service and that's how we promote it, their data isn't getting collected. And then finally, just due to the vast geography of the Parry Sound District and the rural nature of these communities, where individuals access services or even what communities they go to access like leisure activities, um, just maybe outside of the community where they identify it as they reside in, as well as maybe outside of the district altogether. So for example, in Calendar, being that kind of um, the northernest part of that East Prairie Sound area, a lot of those folks will go to North Bay to access services. And so their responses to the survey may be reflective of accessing services outside of the district. And this survey didn't necessarily capture that information. So this specifically affected responses to questions in the survey about the built environment and the aging in place supports. And therefore, just general themes were included in the survey and any specific locations were omitted where they identified that. So future work really should ensure that data collection methods are conducted consistently across the district and that First Nations communities are engaged throughout the process of planning, implementation, data analysis, and knowledge translation. And then finally, just our next steps. So currently, the health unit is developing an infographic to share these results back with the community. So this will include information shared today about the key themes that came out and who provided their input in this survey. Um, and then also how people can get involved in because this is really a community effort and isn't just owned by the health unit, it's owned by everyone. A report was also developed, which I have shared with the organizers today that can be shared with all of you. And at this time has been shared back with community partners and organizations involved with the committee, as well as those who supported with the dissemination of the survey. Our group is currently focused on sharing these results through the report and presentations like I'm doing today, hoping to do them with municipalities, other community partners, and First Nations communities to continue to discuss and engage on how to implement some of these recommendations. So for example, looking at how we can support with increasing the accessible transportation services offered across the district, or how we can increase the awarenesses of services that are available. We're also actively sharing existing resources. So the 2 examples today of the transportation inventory and the 211 promotional materials in our district. So that if there's anything that's already been created, we want to share it to help with increasing awareness of all of the great services available. I think people can kind of quickly think that there aren't a lot of services or that we're underserviced, and maybe that's true in some areas, but in other ways we want to like really focus on the assets in our community. And so, but with that, if there's anything identified as a new resource that's required, our group is happy to kind of hear that and work to support with that as well, developing any resources or initiatives or programs that are needed. So just some final thoughts. The Parry Sound District Age Friendly Committee, we're really in that early stages of developing our work plan and what we want to do now that we have kind of the data to back that up. And we appreciate any feedback and discussions today or in the future. Happy to have conversations offline that can help to inform what our next steps are. And that is all I have today. My contact information is here on the screen. Feel free to either email me or call me at any time if there's any resource you're looking for. I'm happy to chat.
Thanks very much, Taylor. That was a great presentation. So in the chat, lots of hitting on the areas that you suggested. Kara Huggins suggested reaching out to the First Nation nursing stations to get data. Some of our research projects are experiencing similar difficulties, so if we can share what works, that would be
Mhm.
that would be really appreciated too. Are there any questions from the group? Questions, comments, areas of discussion?
Sorry, I'm driving, but what I wanted to also mention, and we're just about to meet with her, but Delana with the Georgian Bay Biosphere Reserve is working on a project related to population health that, again, just trying to not reinvent the wheel every time we do something like that. I think it might be great to collaborate as well.
Yeah, that is great. I know I had connected with Delana in the late fall, but thank you for that flags it that I need to connect with her again. So thank you so much for bringing that up.
No worries.
And if you have infographics or posters and you're looking to get information out, I'm sure just sending them to the family health teams or the nursing stations so we could have them posted is an easy fix for that.
Yeah, I'm hoping that our infographic is finalized and approved in the next month. So I will definitely share that out because the more we can share this information, the better. So thank you.
Does it have a QR code, Taylor?
The infographic,
Yeah,
at this time it doesn't, but I can definitely connect with our communications about putting that on it because that's a great idea.
it might just help drive people to your website too. Any other thoughts, suggestions, comments? I just want to put a shout out to the research grand rounds on July 24th. We are providing lunch. It'll be 12 to 1 in the boardroom. So I hope to see all of you there. We've got 3 fantastic projects to talk about. The students will be presenting, not the research team. If there's nothing else, I think that was a fantastic rounds. Thank you so much, Taylor, on behalf of the Parry Sound Leg and everybody here.
Thank you very
So
much.
much.
Thanks a lot. That was great.
Great. Thanks, everyone.